Gina, thank you so much. Well, hundreds of thousands of Arizonans could lose their health insurance because of cuts in the big, beautiful bill. Senators narrowly passed their version of that bill yesterday.
So now it goes back to the House, and a major sticking point is proposed cuts to Medicaid. It affects so many people. So on your side, Susan, Campbell is here after speaking with some Arizonans who really rely on this money from Medicaid. So what happens now? And, a lot of people are scared.
Yeah, and there is just a lot of uncertainty. So we're going to try to break it all down. And we want to put it in perspective. 1.8 million Arizonans are covered by Medicaid. There are estimates that 250,000 to 500,000 could lose that health insurance. There are also concerns that rural hospitals here in Arizona could close. Some say the cuts are necessary to ensure Medicaid only supports people who really need it. Others say the cuts will end up costing a lot more in the long run.
Person I've ever met.
He's also a fighter.
At 4 days old, he suffered a really serious stroke. He can't move his arms and he can't move his legs. He can't speak. And he can't eat.
Ryan's critical therapies for cerebral palsy and epilepsy are covered by money from Medicaid. His dad's not so worried about potential Medicaid cuts for people with disabilities.
I'm not really worried that would happen.
Alan Dukes is worried about cuts. He's been a driver for decades, but could never afford health insurance.
I've always worked, and I worked hard.
He qualified for Medicaid a few years ago. He says his health care saved his life.
Without it, I don't know if I'll be able to survive. I mean, it's literally, I feel like I'm one of those people that could die without my health care.
According to the nonpartisan Congressional Budget Office, the Senate version of President Trump's big, beautiful bill cuts almost $1 trillion in Medicaid over a decade.
We achieved cost-cutting savings, the largest in the history of the country. Some people say not enough.
Throwing people off of coverage really doesn't do anything as far as saving costs. It just shifts where those costs occur.
Dr. Dan Dirksen is the director of the University of Arizona Center for Rural Health and a member of the Arizona Medical Association.
We would dramatically increase the number of Arizonans without health insurance.
Back to Ryan. His dad works for a nonprofit called Community Options. The organization operates in 12 states, including Arizona, providing support, housing, and employment for people with severe disabilities. The CEO says almost all of the organization's $500 million budget is from Medicaid funding.
That those services have to be intact.
What's the message to lawmakers right now?
People with disabilities are a vital part of our community. We are only evaluated by how we treat our most vulnerable. And I ask that they do that with compassion and dignity.
House Speaker Mike Johnson acknowledged a challenging road ahead for this bill. Again, a lot of uncertainty as to what actually will be cut. Medicaid is funded federal dollars. States have to match. So if there are cuts, states might have to make up the difference. There is just a lot of uncertainty, more questions to ask, but that is why people are sharing their stories. Some say they're worried, some say they're not.
Sure, and state lawmakers have said we don't know where we are going to get that extra money if we have to, fill the gap there. All right, we will stay on top of it. Thank you, Susan, for explaining.